How do we know COVID-19 vaccines are safe for kids?
This is especially important to me because I actually am a dad of two awesome kids. I have a almost 2-year-old son who was born very premature and has chronic lung conditions, and then I have a almost 5-month-old daughter. So absolutely, though I want to make sure that my kids are protected, I also want to make sure that the vaccines that are offered, COVID-19 and then other childhood vaccinations, you always want to make sure that they're safe. So some statistics that I think are important to know just off the top is that over half of all kids 12 to 17 years old in the US have been fully vaccinated. That's really good. That's over 13 million kids who've been vaccinated with both of their doses of the COVID-19 vaccine. Some other data and other stats that are important to know is that almost one-fourth of kids 5 through 11 have had at least one dose. And the vaccines, just like in our adults, they continue to be monitored very closely for side effects. And in fact, one particular side effect or two side effects that come up a lot in my conversations with families have to do with inflammation of the heart or the heart sac, the sac that's around the heart. So that could be myocarditis or pericarditis, or even other outcomes known as seizures. Those are common side effects that people were really concerned about when you talk about these vaccines. So I think it's important to just mention that there's been research and methodology that's been done around that subject as well that shows that those outcomes really aren't shown in kids who are vaccinated, but it's way more common in those who are not vaccinated. So for instance, there's a really good data set that comes from the Vaccine Safety Data Link, which gathers information from 8 health systems in the US. It was analyzed data from 135,000 doses given to kids age 4 and younger who received Pfizer, the Pfizer vaccine. And then there was about 112,000 doses that were given to children age 5 and younger who received the Moderna version. So of that data, you assess safety outcomes, which again include myocarditis, pericarditis, and then other conditions like seizures. And the main takeaway is that none of those adverse outcomes, including myocarditis and pericarditis, were detected amongst children in the 21 days following the receipt of the vaccine. So essentially, these vaccines are safe. And again, those conditions that I'm mentioning, they're more common in kids who are not vaccinated. And on top of that, may have underlying conditions that puts them further at risk for just poor outcomes from a COVID-19 infection. So again, I would recommend getting your little ones vaccinated, especially as we enter the fall and winter months. I think it's really the best move that you can make.
Please contact your doctor with any additional questions you may have or visit the website for your local health department or the CDC at www.cdc.gov/coronavirus for the most up-to-date information.